The girl ignored a warning about red marks on her skin, leading to a tragic event. After giving birth to her baby, 24-year-old Cassandra Kimberly resumed her regular life. After having a kid, her life returned to normal, and she resumed her career, this time with her dad. She thought her life was ideal, working with her father, having a child, and, at the same time, having a career. One day, Cassandra discovered that she had a bug bite on her body, but it didn't seem like a typical bite to her. Because it was really awful, she chose to see her doctor right away to get checked out. The doctor treated Cassandra casually and gave her prescriptions for several medications, including antibiotics, leading her to believe that the pain was just a common bacterial infection. She took her drugs as soon as she got back from the hospital, where she intended to get rid of the bug bite. But after a few days, everything changed drastically, and she was horrified to see what her body looked like. She noticed that she had the flu in addition to an uncomfortable rash that covered her entire body. After realizing something was wrong with her body, she got herself examined. She visited the local hospital's emergency room several times in a short period of time, but no major diagnosis was made. Cassandra's mom got a call one day, and she was so worried. She thought it was a mild flu, not knowing that it was a serious ailment. When Cassandra was brought to the emergency room, her condition had gotten worse over time. She had several blisters on her skin and swollen eyes, and she was no longer able to walk. Cassandra was taken to the hospital's burn unit because her entire body was badly burned. They intended to keep her under observation for a few days to diagnose her real illness. She had the worst days of her life in the hospital, suffering from terrible body rashes that had transformed into blisters with time. Her body was covered with blisters, so she was unable to rest calmly in bed for even a brief period of time. Since it was quite unusual for someone to experience such severe rashes, the experts tried their best to figure out what caused the rash. The doctors took many days to assess her condition before reaching their ultimate decision. That was because the disease can only be treated until a formal diagnosis has been made. Therefore, the family anxiously waited for the doctor's diagnosis. The doctors informed her family that she had an uncommon sickness syndrome brought on by the medications the doctor had recommended for the painful bug bite. They said that, although the parents were now fully aware of her illness, they were powerless to take any action because the syndrome typically develops in patients as a result of administering antibiotics like Pactern or penicillin. The strange syndrome took the 24-year-old Cassandra's life in a matter of days, and neither her parents nor the physicians were able to prolong her life because of her low consciousness level. In an effort to raise awareness of the rare illness, her parents have now begun telling her tale. Their 3-week-old grandchild lost his mother at such a young age, and they lost their daughter. Nothing can make up for what they lost, but they are attempting to help others by spreading the word about antibiotic reactions because they think people should start taking them seriously. We are going to see the signs and symptoms that indicate an adverse reaction to stings or bites. When you are bitten by a bug, you might see or feel the bug on your skin during the attack, if it bites or stings you. Some people may not become aware of a bug bite or sting until they experience one or more of the following symptoms: swelling, redness, rash, discomfort in the muscles or affected area, heat that itches the area where the bite or sting occurred, and tingling or numbness in the affected area. What do you do? See a doctor for testing to rule out illnesses or diseases you may have picked up from the bug if you feel sick or have flu-like symptoms in the days after the bite. What is the prognosis going forward? Most stings and bites go away on their own after a few days of minimal discomfort. Keep an eye out for infection symptoms in the afflicted area. If the wound doesn't seem to be healing after a few weeks or seems to be getting worse, see a doctor. If treated improperly, severe reactions from bites and stings can be deadly. After a severe allergic response, an epinephrine autoinjector will probably be prescribed by a physician. It's one hormone that can stop anaphylactic shock. How does one prevent stinging or biting? Number 1. When near beehives or nests of predatory insects, exercise caution. Employ experts equipped with the right safety gear to remove a hive or nest. Number 2. Consider taking precautions when spending time outside, such as wearing caps and fully covered clothing. Number 3. Wear hats and clothing that provide full coverage. Number 4. Steer clear of perfumed lotions and perfumes. Number 5. Putting permethrin on clothing, using citronella or insect repellent, and covering food and beverages to avoid being bitten by black-legged ticks. Let's discuss antibiotics. In order to treat bacterial illnesses, antibiotics either eradicate or significantly reduce germ development. They accomplish this by targeting the bacterium's wall or coating, interfering with their reproduction, and preventing the bacteria from producing proteins. They are also known as antibacterials. They treat illnesses by eliminating or inhibiting bacterial growth. In 1936, the first antibiotic of today was utilized. Prior to the development of antibiotics, bacterial illnesses accounted for 30% of all fatalities in the United States. Antibiotics have made it possible to treat infections that were formerly fatal. Today, antibiotics are still effective, life-saving drugs for patients with some very serious infections. Additionally, they can stop less dangerous illnesses from getting worse. The classifications of antibiotics are numerous. Antibiotics are more effective for specific types of bacterial infections. Antibiotics come in different forms, such as tablets, capsules, liquids, creams, and ointments. The majority of antibiotics may only be purchased with a doctor's prescription. Some ointments and lotions containing antibiotics are sold without a prescription. Do you know how long antibiotics take to work? As soon as you start taking antibiotics, they start to function, but it could take 2 or 3 days before you feel better. After receiving antibiotics, recovery times vary. It also depends on the type of infection you're trying to treat. It's recommended to take most antibiotics for 7 to 14 days. Sometimes shorter treatments are just as effective. The appropriate antibiotic type and duration of treatment will be determined by your physician. To completely treat your infection, it's advisable to adhere to the whole antibiotic prescription even if you start feeling better after a few days of therapy. Additionally, it can aid in preventing antibiotic resistance. Until your healthcare provider gives you the all clear, don't stop taking antibiotics early. Here are some important steps to be taken to decrease inappropriate use of antibiotics. Number 1. Antibiotics should only be taken for bacterial infections. Antibiotics should not be used for viral illnesses, including the flu, the common cold, cough, or sore throat. Number 2. Take antibiotics as instructed by a healthcare provider. Bacterial resistance may be caused by using the incorrect dose, missing doses, or taking it longer or shorter than prescribed. Before stopping an antibiotic, even if you feel better after a few days, talk with your healthcare provider. Number 3. Use the appropriate antibiotic. Resistance may develop if the incorrect antibiotic is used to treat an infection. Antibiotics prescribed for someone else should not be taken. Moreover, avoid using antibiotics that were used in a prior course of therapy. For your particular kind of infection, your healthcare provider will know which antibiotic is best. Although antibiotics can be useful in treating bacterial infections brought on by insect bites, caution must be exercised when using them. Antibiotic resistance can be caused by overuse or unnecessary use of antibiotics, making treating bacterial illnesses more difficult in the future. Because of this, it's critical to heed medical advice and use antibiotics only as directed by a healthcare provider for a verified bacterial illness. For straightforward insect bites, healing usually only requires appropriate wound care and symptomatic treatment. If you find value in the content we provide on this channel, give it a thumbs up and please leave a comment down below with your thoughts about this video. To get the latest update, kindly hit the subscribe button. Thanks for watching. See you in the next video.